What are the key findings of the 2013-2014 Municipal Audit Report? What is being done to root out corruption at municipal level? And why are some public servants still doing business with the state? And how do SALGA and SANCO ensure that municipalities run professionally? What time is it? This is Question Time. Hello and welcome to the show. My name is Alicia Jali, standing in for Mr. Mpodzedu. Now, disciplinary action against negligent and bad councillors. Government must approach political parties to remove corrupt and underperforming municipal officials. Now, these are just a few of the main concerns raised by Cooperative Governance and Traditional Affairs Minister Pravin Gordhan during the recent release of the 2013-2014 Municipal Audit Report by the Attorney General Kimi Makwetu. Mr. Makwetu stated that over-reliance on consultants resulted in deteriorating audit outcomes due to poor control and weak supply chain management. Now, despite laws forbidding public servants from doing business with the state, 290 municipalities awarded tenders to people from within the municipalities, and with at least 4,043 tenders worth 3.7 billion rand. But the authorities are failing to eradicate corruption at municipal level. This is the question that we're asking today. And a reminder to our viewers that you can also call us and air your views on the following numbers. It's 089 110 4210 or 002789 110 4210. Our Twitter handle is @QuestionTime24. Well, my guests today are Mr. Abraham Mashishi, who is a treasurer at SANCO, and joining us on the line from Bisho in East London is Simpiwe Nzengwa, who is an executive director for municipal finance. Sir, a very good evening to you. Thank you so much for joining us on Question Time.
Good evening, Jali. How are you?
I'm very well, thank you. But Abraham, let's say hello to Simpiwe on the line. Simpiwe, thank you so for joining us on Question Time this evening. Welcome.
Thank you. Good evening.
All right, let's start with you here in studio, Abraham. What is being done to root out corruption at municipal level?
I thank you very much, and also to the viewers. I think currently there are no any sharp measures that are being implemented by the state or even the Chapter 9 institution, your public protector, and your SIU. All is well. Everyone is just doing as you wish. People are just looting money for the state. People are just taking other institutions to court without paying any single cent. So currently, our government is not biting. Nothing is happening up to the culprit, up to so far. And as SANCO, we are very much worried because of this is our tax monies. The poor community are suffering. People are just, even if it's a defenseless, community members are like defenseless people that cannot fight for themselves. Just like a woman, when you fight with a man, you can't expect.
Leaders in SANEC, I greet all of you who are leaders of various forums attending this conference. It's a real joy and a pleasure for me to have been asked to do the opening of this conference. I do not need to advertise Durban or eThekwini, as the Premier has done so. There's a delegate who told me that this morning they experienced the 9th wonder of the world as they were walking along the beach from their hotel rooms, and they said, this is simply a world-class city, Durban that is. So we applaud you, Mayor, for continuing to present Durban as a world-class city. which continues to attract various conferences and conventions in this part of our country. This conference is taking place at a critical moment in our collective struggle as a nation against HIV and AIDS and tuberculosis. In many ways, we are what you could say at an inflection point. Thanks to the progress we have made, thanks to partnerships we have forged along the way, thanks to the resources that we have collectively mobilized, we now know that the fight against HIV, AIDS, and TB can indeed be won if we continue to be determined to win this struggle, having moved away from our denialism and having resolved that we are going to engage in this struggle. It can be won, that is for sure. The question that we must ask at this conference is whether we have the means, whether we have the will, whether we have the knowledge and the courage to prevail. Today we reflect. We reflect on the road that we have traveled. And indeed, we have traveled a long road, as Dr. Nono Simelela was saying. We reflect on lives that we have lost, on children that were orphaned, on livelihoods that were diminished, as Sipogazi was saying here. We reflect also on how prejudice has been challenged, treatment expanded, awareness raised, and transmission prevented. We reflect also, as we must, on the mistakes we have made and also on the lessons, and many of them quite expensive lessons we have learned. But today we also refocus, drawing on our experience and using the insights we have gained. We are better able to identify where to apply our efforts to achieve the greatest possible impact. Today, we must also renew. We renew our commitment, we renew our determination, we renew what I would call our social compact, which has been forged over many years of shared struggle. We renew our commitment to the achievement by 2030 of a generation of under-20s that is largely free of HIV. At times, we have differed. Throughout, we have debated, we have discussed, we have conversed, and we have communicated. Ultimately, we have found agreement. This conference is concerned with reflection, refocusing, and renewal. It should, as the previous South African AIDS conference did, also address itself to responsibility. It should begin to address the issue of the responsibility that we have collectively. We shall not overcome this epidemic unless all of us, collectively and individually, working side by side, accept that we have a responsibility. We have a responsibility as government, as its employees, as every sector of civil society, as developmental agencies, as communities, as scientific forums, as religious institutions, as youth groups, and as researchers. In our personal lives, in our own behavior, we also do have a responsibility. We have a responsibility as parents, as spouses, as partners, as girlfriends, as boyfriends, as mentors, and indeed as role models. We have a responsibility to ourselves, and we also have a responsibility to others. Ladies and gentlemen, comrades and friends, the government of the Republic of South Africa accepts and is determined to fulfill its own responsibility. On World AIDS Day in 2009, President Jacob Zuma declared our intent to confront the AIDS epidemic. He said, "We have no choice but to deploy every effort, mobilize every resource, and utilize every skill that our nation possesses to ensure that we prevail in this struggle for the health and the prosperity of our nation." Under the leadership of President Jacob Zuma, South Africa has indeed turned the tide on HIV. That is an undeniable fact. The advances that we have made have been huge. Many emanate from public programs, but still others have been made by grassroots activists, many of whom are present in this room today. South Africa is acknowledged by UNAIDS and others as global and continental leaders in the HIV response. We have the right policies in place and the political will to see them implemented. South Africa has the biggest HIV program in the world, with more than 3 million people on life-saving antiretrovirals, moving on to 5 million, as Sipogazi said. In 2010, we launched a national HIV counseling and testing campaign in which 20 million tests were conducted in a period of 20 months. We distributed more than 700 million male condoms last year and have conducted more than 1.6 million medical male circumcisions in public facilities in 2010, since 2010. Now, these results are significant. This achievement is significant. We have the biggest HIV program in the world. People are living longer, and fewer people are dying of AIDS and TB. Life expectancy, as attested to by a few speakers before me, increased from 53 years in 2006 to 62.2 years in 2013. This is a great achievement. HIV-associated deaths in pregnant women, infants, and children under 5 have also declined. We have also seen a decline in new HIV infections since its peak in 2004, especially amongst those less than 15 years of age. We have reduced mother-to-child transmission dramatically to less than 2.6% in 2012. This means that we are on our way to eliminating mother-to-child transmission. And this we should applaud. This we should say thank you to. This, ladies and gentlemen, is an encouraging statistic. But they do not fully capture the human impact of our interventions. They do not tell the story of the many thousands of people who can now manage HIV infection as they would any other chronic disease. They do not tell the story of the many children of HIV-positive mothers who are now born HIV negative and remain so. They do not tell the countless times that transmission is prevented by responsible sexual behavior. Yes, they do not tell the story of hope, hope that is restored and confidence that is regained, as Dr. Nono Simelela was saying. These, ladies and gentlemen, are the stories to be shared, cherished, and celebrated. Yes, there are stories that we must celebrate. At times, as South Africans, we engage in a sport called self-mutilation. We cut ourselves to shreds. We do not look at what we have achieved with a view of drawing inspiration of doing even much more in the future. We must celebrate these achievements. And it does not mean that we do not have work ahead of us. As Kensani and Sipogazi were saying here, and I agree with them completely. I embrace what they were saying, I accept it, and the government does internalize what they are saying, and we have heard, we have heeded what they are saying, because they are telling the truth. As these two sisters were saying here, we do face challenges. There are still challenges that lie ahead. And the challenges they were articulating are precisely what we need to be confronting together, working together, walking step by step until we have won our struggle against HIV. That is what we should be focusing on. Our country has more than 6.4 million people living with HIV. That, by any number, is a huge number. That is where the challenge is. More than 1 in 5 people with HIV in the world live in our country. We have about 450,000 new HIV infections and 360,000 new TB infections each year. Now, that is the challenge that lies ahead for all of us, not only for government, but for each one of us seated in this hall today, because we are all implicated, we are all involved, we are all part of this problem and this challenge. We are called upon to engage in this challenge. None of us escapes this challenge. We are part of it, and together we must confront it. That is what we are called to do. A recent survey estimated that 2 million South Africans who are living with HIV do still not know their own status. We need to find the resources to expand further what is already the largest HIV treatment program in the world and show better adherence to treatment. Then we need to be able to sustain it for many more years to come. South Africa is unique on the African continent in that we fund more than 80% of our HIV and TB response with funds from the fiscus. These are own-generated funds from all of us as South Africans. This goes to show that as South Africans, we are living out our national ethos, which is umuntu ngubuntu ngabantu. That's what we are living out. Mutu ki mutu kabatu. That's what we are. We are grateful to our donors and development partners such as PEPFAR, and thank you very much, Ambassador, for the US continuing to fund many of our AIDS programs. We thank you, and we say, please, remain committed. Do not disengage. You have been our partners in this struggle. We want to see you continuing being our partner. The Global Fund is also our partner, and they continue to stand with us by financing a part of our national response. We have set ourselves really outstanding ambitions. As part of the global 90-90-90 targets, we want to have at least 90% of South Africans that are HIV positive on treatment. We want 90% of those on treatment to be virally suppressed. Such ambition requires a far greater commitment of resources than ever before. Yet, the cost of putting so many more people on treatment is insignificant to the human cost of not doing so. Simply put, as a country, we cannot afford not to invest in HIV prevention, treatment, and care. That is our commitment. That we will continue to do. As government, as a country, we have difficult decisions to make. As we step up our AIDS response, we need to find the resources to educate our children, to house our people, to build infrastructure for our future economy, and to provide social support to those South Africans who are most in need. We are confident that the recently concluded South African investment case for HIV and TB will provide guidance on how to spend our money to achieve even better results. Yet, however much we are able to expand this program, putting more and more people on lifelong treatment is ultimately not sustainable. The tap of new infections has to be turned off. We need to stop new infections. Behavior change interventions are proving much harder to implement than clinical interventions. The transmission of HIV has to do with sex, and sex has to do with complex human behavior. And human behavior has to do with a myriad social, economic, and cultural factors. We need a massive HIV prevention campaign that begins with the promotion of condom use and the reduction of multiple concurrent partnerships, but that also addresses sexual coercion, transactional sex, intergenerational sex, risky sex, linked to the use of alcohol and drugs, lack of access to work for young women, ignorance, powerlessness, and poverty. We need to dramatically reduce the rate of HIV transmission amongst young people. The results of the HSRC 2012 National HIV Prevalence Incidence and Behavior Survey raised what I would call a deep concern about the rate of new HIV infections in our country. A quarter of new HIV infections in the world occur in South Africa, sadly. The HSRC survey also showed that 1 in 4 of those new infections occurs among young women and girls between ages 15 and 24. These young women are the future of our country. They are the scientists, they are the engineers, they are the doctors, they are the teachers, the public servants, the leaders, the workers and mothers of tomorrow. If we fail them as a nation, we will fail. We must develop new and innovative responses that address the specific needs of young women. I hope that new information from this conference, the innovative ideas that will come from here, will assist us to strengthen our interventions interventions that will help to address the challenges that young women are facing today. We must confront the reality that the astonishing high infection rates among young South African women has much to do with the behavior of men. It has much to do with how men of that age and older relate to women. It has much to do with the forms that social interaction takes and how sexual relations are conducted. It calls for greater awareness, greater respect, and greater responsibility amongst all of us. But beyond this population group, we need to focus prevention strategies on we need to focus prevention strategies on other areas where they will have the greatest impact. We have started the work on a national HIV prevention program among sex workers. We have suspected for a long time that HIV prevalence in this sector is much higher than the general population. New research has found very high HIV prevalence among sex workers of between 40 to 70% in Cape Town, Durban, and Johannesburg. While we have a few programs that target this sector, we must rapidly scale up access to prevention, treatment, and care and support for sex workers. There is much more to be done to focus our effort on other areas where HIV is concentrated, such as in our major cities, amongst other populations who are at a higher risk of HIV infection than the general population. Ladies and gentlemen, as we reflect on what we have achieved and the progress that we have made, it is also fitting that we extend our deepest gratitude to the millions of South Africans who have made this possible. We must thank those who have taken time off and pay for transport to collect their antiretrovirals and who diligently take their drugs. We've got to thank them because they continue to lead a healthy lifestyle. And we've got to thank those South Africans too, who have in their millions, come forward to be tested for HIV, and those who have also come forward to be screened for tuberculosis. We thank them as well. And we must also thank those many South Africans, millions of them, who use condoms as a matter of course and as a matter of principle when they engage in sexual relations. We thank them as well. And we must thank, yes, we must also thank those who take responsibility for themselves and responsibility for others. We thank them as well, because by taking responsibility for others, they are saving our nation. Next year, in 2016, South Africa will be hosting the 21st International AIDS Conference. When the International AIDS Conference was last held in South Africa in 2000, there was still insufficient attention paid to the epidemic or the impact of the epidemic in Africa. The AIDS 2000 conference in Durban helped to change that and put the focus on the continent where the epidemic has taken its greatest toll. AIDS 2016 can be another watershed conference. It is an opportunity to turn conviction into action. It'll give us an opportunity to turn goals into outcomes. It'll also be an opportunity to turn hope into reality. It will be an opportunity to demonstrate that we have achieved a lot as a nation. It will also be an opportunity to share what we have learned, and it will also be an opportunity for us to learn from others. As our experience in South Africa shows, HIV, AIDS, and tuberculosis will not be overcome without a sustained collective effort. And we cannot afford to let up. As I interact with my colleagues on the South African National AIDS Council, as we continue to debate issues, and as we continue to realize that the only way we can confront this challenge is to work together, I see in their eyes a great determination, a great focus. A few days ago, we had a lekgotla at the South African National AIDS Council, where my colleague Steve Letseke and I was leading the process of getting SANAC to begin to refocus, to renew its commitment. I could see in the eyes of everyone who participated that there's a renewed energy to meet this challenge. This is what we need as a nation, a renewed energy so that we can refocus, so that we can address, yes, all of us collectively, to the problems that Kensani was talking about. So that those pictures that she was showing on the wall should be something that resides in our past. So that the tales and stories that Sipokazi was talking about her own sister, should be something that is relegated to our past. This is the task that we all have, collectively as a nation, but more particularly ourselves as government, ourselves as activists, as medical people, as researchers, as scientists. All of us sitting here have a task to engage in this struggle. Let this conference reignite our enthusiasm. Let it reignite our energy. Let this conference set us on fire once again as South Africans to meet this challenge. Thank you very much.